If you're ever wondering why your teen is struggling with functional neurological disorder, short for FND, then I have the answer for you. In this video, I'm going to talk about the cause of teen FND. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. If you're new to this channel, welcome, and make sure to hit subscribe, like this video, and share so then we are increasing the awareness about FND. Guess what? April is FND Awareness Month, but in my mind, every day is FND Awareness Day, right? So let's talk about the $1 million question that probably many parents are up all night searching on Google, why this is happening in your child's body in the first place. So let's dive in. And if you're wondering what FND is in the first place, then go back to this video to know what FND is. And this is a 4-part series of the videos walking you through all things teen FND. So back to why. In order for you to know why, you need to know 2 different categories of things. One is something called biopsychosocial phenomenon, and the second one is called the 3P. So essentially, FND is no longer a pure mental health disorder. Therefore, if your doctor is basically saying, oh, it's all in your child's head, oh, it's all stress, oh, it's all anxiety, oh, it's gotta be a trauma, what kind of trauma did you have, that kind of thing, then you know immediately this doctor does not know what they're talking about. Okay, so biopsychosocial model basically says FND has a lot to do with this biological thing, psychological thing, and social thing. And let me walk you through. When I say biological, it could be illness, injury, brain function, big time, daily functioning, like eating and sleeping habits, genetics, all the other medical conditions, and then maybe medication. And all of these things are part of the biological. And psychological, I'm not talking about anxiety or trauma or stress. Well, that could be part of it. However, what I'm talking about here in the psychological section is more about your child's belief system, the mindset, coping skills or lack thereof, and then the ability to come back from anything and everything that it gets in the way, aka resilience in my mind. And if there are other psychiatric concerns that could go into the psychological factors. Social factors are things like friends, family, school, extracurricular activities, social expectations, cultural expectations, what's happening around your child, whether it's immediate environment or broadly speaking. You see, this is why FND is not just one thing that is causing the problem. And any of these biological, psychological, and social components of the FND can be one of those 3 Ps, which is the second component. The first P is what it's called predisposing factors. So it's basically what was kind of cooking in the oven. So anything in that biological, let's just say your child had a recurrent injury or having recurrent illness, and maybe that's something that was kind of cooking in an oven long before the FND symptoms started. So that's predisposing factor. Precipitating factor, the second P, is basically what triggered. So maybe that was one concussion. Maybe that was the move you guys did. Maybe that was the breakup from a friend. Maybe that was the bullying incident they had. So it could be just about anything. And maybe it was the virus. And maybe it was whatever the case. Essentially, that is a precipitating factor. It could be any of the biopsychosocial things. And then the third P is basically perpetuating factor. So this is not necessarily the reason why your child is having an FND. However, what is keeping the fire of FND alive? Like you parents over accommodating, your child over fixated and hyper vigilant and hyper focused on symptom. Like there is a clipboard and measuring how many times the episode is happening, what is exactly happening, how long it's happening, all of those things that are typically normal, right? Things. But unfortunately, those things actually don't help. That's why they are part of the perpetuating factors. Now, the biopsychosocial phenomenon and the 3 Ps, the predisposing, precipitating, perpetuating factors, they all go together. And that's why it can be very confusing for most families and many doctors. Now, if you want to know how to then overcome this FND, because that's possible, stay tuned because in my next video, I'm going to talk about that. I hope you found this video helpful, and comment below exactly what you think that biopsychosocial phenomena are for you and your child. Well, thank you so much for watching this video, and I will see you in the next video.